Urinary catheterization of males and females. Urinary tract infections are the most common type of healthcare-associated infections, accounting for more than 30% of healthcare-associated infections reported by acute care hospitals. Virtually all healthcare-associated urinary tract infections are caused by instrumentation of the urinary tract. CAUTI has been associated with increased morbidity, mortality, hospital costs, and length of stay. The good news is that many CAUTIs can be prevented with recommended infection control measures. So what are these recommendations for prevention of CAUTI? Well, insert catheters only for appropriate indications. Leave the catheters in place only as long as needed. Ensure that only properly trained persons insert and maintain catheters. Insert catheters using aseptic technique and sterile equipment. Follow aseptic insertion and maintain a closed drainage system. Make sure you maintain an unobstructed urine flow, and then practice hand hygiene and standard, or whatever the appropriate isolation protocol is, according to the CDC and HIC-PAC guidelines. This is a list of approved indications for catheter insertion. If your patient has acute urinary retention, if they have acute bladder outlet obstruction, if you need to accurately measure urine output in the critically ill, to assist in healing of an open sacral or perineal wound in incontinent patients, to improve comfort for end of life, patients requiring a strict prolonged immobilization, such as an unstable thoracic or lumbar spine, and then selected perioperative needs, if they have a urological surgery or other surgery on contingent structures of the genitourinary tract, and then an anticipated prolonged duration of surgery. Most catheters that are placed for this reason should be removed in the recovery room. Also, if the patient is going to receive large volume infusions or diuretics during surgery, and if you need to monitor intraoperative urinary output. Now we will go into a few different types of urinary catheterization, starting with in and out. The procedure is implemented when you need to obtain a sterile urine specimen, or if they have urinary retention. The catheters are usually non-latex, shorter, and more rigid. In the hospitalized patient, this is done as a sterile procedure. If you're teaching the patient for home or self-catheterization, it's a clean procedure. Here's a few separate types of things you may see for an in and out cath. The picture on the left that says Easy Cath is just a catheter. The picture on the right is a full catheter kit with cleaning soap, forceps, a sterile basin, and then the red tube, which is the catheter itself.